You're finally home with your beautiful new baby. You're probably spending hours just staring, memorizing every little eyelash and tiny finger. But then you notice something: their skin, and maybe the whites of their eyes, have a bit of a yellow tint. They also seem way sleepier than you expected. You've likely heard of newborn jaundice, and you were probably told it's common and usually harmless. That is absolutely true. Most of the time, it's no big deal. But in some rare cases, it can be a sign of something much more serious. So, how do you know when it's just a normal newborn thing versus a red flag that needs an immediate call to the doctor? That's exactly what we're going to cover. We'll walk through the 5 critical warning signs that separate normal, harmless jaundice from a dangerous condition. Knowing these will give you the power and peace of mind to protect your baby. First, what even is jaundice? It's the yellow color you see, and it's caused by something called bilirubin. Bilirubin is a yellow substance made when the body breaks down old red blood cells. This happens to everyone. But a newborn's liver is brand new and still learning the ropes, so it can't always clear out the bilirubin fast enough. When it builds up, you see that yellow tint. This is called physiologic jaundice, and over half of all newborns get it. It usually shows up around day 2 to 4, peaks around day 5, and then goes away on its own in a couple of weeks. But there's another type, pathologic jaundice, that signals an underlying problem. This is where our red flags come in. These are the signs that bilirubin levels might be rising too high, too fast. So let's get right into the first one. Smiley face, red flag. The spread and color of the yellow. The first red flag isn't just that your baby is yellow, but where and how yellow they are. Normal, mild jaundice usually sticks to the baby's face and the whites of their eyes. The red flag is when that yellow color starts to spread and get deeper. Jaundice actually follows a predictable path. It starts at the head and moves down the body. So, you might see it on the face first, then it might creep down to the chest and stomach. If you start seeing that yellow tinge on your baby's arms or legs, that's a sign that bilirubin levels are climbing, and you should call your doctor. The really critical warning sign is seeing yellow on the palms of the hands or the soles of the feet. If jaundice has reached the hands and feet, it often means the bilirubin level is very high and requires an immediate call to your doctor or a trip to be seen. Also, pay attention to the color itself. Is it a faint yellow, or is it turning into a deep, almost orange color? A more intense color means rising levels. Here's a helpful tip, especially for babies with darker skin: gently press your finger on your baby's nose or forehead for a second. When you lift it, the skin will briefly look yellow if jaundice is present. And always check in good, natural light, like near a window. Artificial light can play tricks on your eyes. So, for red flag number 1, don't just see if your baby is yellow, see where they're yellow. If it's spreading down to the legs, and especially to the palms and soles, it's time to make that call. Smiley face, red flag. Extreme lethargy and difficulty waking. Newborns sleep a ton, we're talking 16 to 18 hours a day. So how do you know what's normal sleepiness versus a real problem? The red flag here isn't just a sleepy baby, it's lethargy. Lethargy is an extreme exhaustion where your baby is consistently hard to wake up. A healthy newborn might be sleepy, but you can still wake them for a feeding. You can unswaddle them, change their diaper, tickle their feet, and they'll wake up enough to eat. A lethargic baby, on the other hand, barely stirs. They might just fall right back into a deep sleep. This profound sleepiness is a major warning sign. As bilirubin levels get very high, they can start to affect the brain, causing this state. It's a sign that jaundice is becoming more than just a cosmetic issue. This ties right into another part of the red flag: poor feeding. A baby who is too sleepy to wake is too sleepy to eat. They might refuse the breast or bottle, have a really weak suck, or fall asleep after just a minute or two, long before getting a full meal. This kicks off a dangerous cycle. Poor feeding leads to dehydration, which makes it harder for the baby to get rid of bilirubin in their pee and poop. That makes the bilirubin level go even higher, which in turn makes the baby even more lethargic and less interested in eating. So trust your gut. You know your baby. If you feel their sleepiness has crossed a line from normal newborn to genuinely difficult to wake, or they just don't have the energy to eat properly, that's a major red flag. Don't wait. Call your pediatrician. Smiley face, red flag, an unusual cry or changes in muscle tone. This next red flag involves changes that can seem really frightening, but it's vital to know what you're looking for. When bilirubin levels get dangerously high, they can irritate the brain and cause some very distinct signs. First, listen to your baby's cry. We're not talking about a normal "I'm hungry" cry. The cry associated with severe jaundice is often described as unusually high-pitched and shrill. Many parents who've been through it say it's a sound their baby had never made before. It just sounds wrong and alarming. The second sign is a change in muscle tone. This can go one of two ways. Your baby might suddenly become very floppy and limp, like a rag doll. Or, they could do the complete opposite and become stiff and rigid. A very specific and urgent warning sign is when a baby arches their back and neck backwards. This posture is an involuntary reaction to brain irritation and is considered a medical emergency. These signs, the high-pitched cry, being either too floppy or too stiff with an arched back, are symptoms of a condition called acute bilirubin encephalopathy. This means the bilirubin is actively affecting the brain, and you need to get emergency medical help immediately. While this is incredibly rare, it's the entire reason we take jaundice seriously. Catching these signs early allows for treatment that can prevent permanent brain damage. Smiley face, red flag, changes in urine or stool color, what goes in must come out, and your baby's diapers are like little health reports. This is especially true with jaundice, since the body gets rid of bilirubin through urine and stool. Let's start with urine. A healthy, hydrated newborn's pee should be pale yellow or colorless. The red flag is if your baby's urine is consistently dark yellow or even a tea or cola color. This can mean the bilirubin levels in the blood are so high that the kidneys are working overtime to get rid of it. It can also be a sign of dehydration, which we know makes jaundice worse. Now, let's talk poop. A newborn's first few stools, meconium, are dark and tarry. After that, they should transition to a yellow, green, or brown color, often mustard yellow for breastfed babies. The red flag for jaundice is stool that is pale, chalky, gray, or white. Wait, isn't yellow the color of jaundice? Why is pale stool a bad thing? Well, normal yellow or brownish stool gets its color from bilirubin that has been processed by the liver. Pale or white stool means that bilirubin isn't getting into the intestines at all. This suggests a serious problem, like a blockage in the liver or bile ducts, which needs urgent medical attention. So, become a diaper detective. If you see dark, tea-colored urine or pale, chalky white stools, call your doctor. Smiley face, red flag, the timing is wrong. Our final red flag is all about the timeline. Normal jaundice follows a predictable schedule. It appears on day 2 or 3, peaks around day 4 or 5, and is gone by about 2 weeks of age. A red flag is any jaundice that doesn't follow this script. There are 2 timing issues to watch for. First, jaundice that shows up within the first 24 hours of life. If your baby is yellow on day 1, this is not normal physiologic jaundice. It almost always signals an underlying issue, like a blood type incompatibility between mom and baby or an infection. This causes a very rapid rise in bilirubin and needs immediate medical care. Second, jaundice that lasts too long or gets worse. While some mild jaundice can linger for a few weeks in healthy, thriving breastfed babies, any jaundice that sticks around for more than 2 to 3 weeks needs to be checked out by a doctor. Also, if the jaundice isn't fading after the first week and seems to be getting worse, or if it goes away and then comes back, those are clear reasons to call your provider. The timing tells a story. Jaundice that starts too early or hangs on too long is a sign that something else might be going on, and it definitely warrants a checkup. Those first few weeks with a new baby can feel like a whirlwind, but now you are equipped with the knowledge to handle jaundice. Let's do a quick recap of the 5 red flags. The spread, yellowing that moves to the belly and legs, especially the palms or soles. Lethargy, extreme sleepiness, making your baby hard to wake and too tired to eat well. Unusual cry or muscle tone, a new, high-pitched cry, or a baby that's strangely floppy or stiff. Changes in diapers, dark, tea-colored urine or pale, chalky white stool. Wrong timing, jaundice in the first 24 hours or that lasts more than 2 to 3 weeks. Remember, the vast majority of newborn jaundice is common and completely harmless. These red flags are your guide to knowing when to take action. This isn't about causing panic, it's about empowering you. Severe jaundice is treatable, and serious complications are preventable when caught early. Always trust your instincts. If you feel like something is off with your baby, it's always the right decision to seek help. If you have any concerns or see any of these red flags, please put down your phone or computer and call your pediatrician or local emergency services right away.